I'm going to try to use a lavalier mic. I hope you can hear me. So as Atila started to suggest, I can't tell you much about information theory, but I'm going to try to tell you about how information flows in markets and how we think about markets as computational devices in a way, but that they need to get the information that they need. So markets are ancient. You know, if you look at the distribution of stone tools far from where they were built, you can see that markets are older than agriculture. And along with all the goods and services that markets exchange, they also are tools for exchanging information. And for a long time, we thought of markets a little bit the way we think of languages, human artifacts, but you think of them a little bit like naturally occurring phenomena that you can't really alter. So I'm speaking to you in English, but we all use English the way we received it. We don't think very much about changing it. And you can think about markets a little bit that way too, except markets have much more concentrated user groups. They often have proprietors, they have influential users. And so markets are things that we can change and we can build. And of course today, many of our biggest and fastest growing businesses are businesses that run marketplaces, businesses like Google or Amazon. But just as there are lots of different kinds of natural languages, there are also different kinds of markets. And I'm going to maybe a little bit expand your idea of what a market is today by telling you about matching markets, which are markets in which you're not just dealing with commodities, you care who you're dealing with. So in a group like this, we often think about how to allocate resources, maybe optimally. But when you think about optimization, you mostly think you have the information needed to tell what's a good allocation. The reason we need markets is often that information is distributed privately. It's lots of different people have the information that would determine what's a good allocation, and we have to elicit that information in the course of finding the allocation that we want to have. So designing a marketplace is about a way to help do some kind of optimization while eliciting the information you need. And of course, when you ask people what their preferences are, what they would like, what they're willing to pay, they're going to want to know what you plan to use that information for. So you have to elicit this information under the constraint that they should be willing to reveal it, knowing how you're going to use it. Okay, so there are incentive constraints. So think of the problem of eliciting the information as opposing some additional constraints on the optimization. And as I say, there are a lot of different kinds of markets. There are commodity markets where the main job of the market is to find prices that decentralize the market, and there are matching markets which are more complex. So think about the New York Stock Exchange. It's a commodity market. The job of the New York Stock Exchange is price discovery, to find prices at which supply equals demand. And when you're trying to buy 100 shares of AT&T on the New York Stock Exchange, you don't care who you're buying it from. You don't worry that whether they've taken good care of those shares while they had them, and they don't worry whether you'll take good care of them. It's an anonymous market where price does all the work. But a lot of markets aren't like that. I work at Stanford University, and Stanford doesn't, in admitting its freshman class, doesn't seek the price at which supply equals demand. It doesn't raise tuition until just enough applicants remain to fill the seats. It's expensive to go to Stanford, but it's cheap enough that a lot of people would like to go. And there were all these other market institutions that decide who gets to go to Stanford, you have to apply, you have to be admitted, there are letters of recommendation from your high school, there are all sorts of things going on. And the same thing is true of labor markets as is true of college admissions. Google doesn't hire its engineers by lowering the wage until just enough people want to come work for Google. Google is a desirable job. You can't just decide to go work for Google, you have to be hired. You can't just decide to attend Stanford, you have to be admitted. So matching markets are markets where price does not do all the work. They're markets in which you can't just choose what you want. Even if you can afford it, you also have to be chosen. And so matching markets, big important markets of the kind that we all deal in, where we go to school, where we work, they're a lot like marriage. You can't just choose your spouse. You also have to be chosen. And so a lot of courtship is involved. There are a lot of institutions that make the market work that don't just have to do with price. A lot of information has to be exchanged because you care with whom you are matched. So I'm going to tell you about some matching markets, all of which are a little unusual, because I want to show you that there are a lot of things that are markets, but but the first ones I'll talk about are the least unusual because they're labor markets, and we all participate in labor markets. But I'm going to tell you about the market for doctors in the United States, because it's an unusual one. It's one in which computation and thinking about information and how it flows has played a big part. And then I'll tell you about another class of allocation problems that actually has a similar set of technical solutions, which is school choice, and Atila, who's here, is going to talk about that in the next session as well, and he's been a big player. And then we are going to have a session, I think, in this room after this talk, where a number of people will talk about market design more generally, and there I'll tell you about an even more exotic market, which has to do with kidney exchange, how we arrange transplants for kidneys in the United States these days. But as I tell you about all these markets, they're all different and the details all matter. So in that respect, every market is different, like every language is different. But there are some things in common to marketplaces that make markets work well. So I'll sometimes speak interchangeably about markets and marketplaces, but again, if I were studying language, I might say to you I was studying English, but the language English, but the things I would be studying would be books and conversations and tweets. They'd be places where the language happens. And so marketplaces are the places where markets happen. And to design a marketplace that facilitates the market well, the marketplace has to accomplish a couple of things. It has to be thick. It has to help the market become thick. It has to attract participants so that there are a lot of people who come together who want to transact with each other. And then, once it's a thick market, it sometimes faces the problem of congestion. There are all these people with whom you might transact. How do you process all the transactions and figure out which ones you want to make? So the marketplace has to help you to do that. And then it has to be safe to participate in and to reveal that information that we each have about which jobs we'd like, which people we'd like to employ, where we'd like to live, all of the things that go into a labor market or even a marriage market that people have to reveal in order for us to find a good outcome. It has to be safe for them to reveal that information. By the time I'm done, I'll have shown you some clearinghouses that don't work well and where it's not safe to reveal that information. I'm going to talk today about what we do to make it safe to reveal information. So before I talk about these unfamiliar markets, let's just think a little bit about one that's, you can watch it growing and it's becoming familiar. Let's think about Airbnb. So from the point of view of thickness and congestion and safety. Well, so how about thickness? Think about how Airbnb grew. Not too long ago, they were just a website for people who wanted to sleep on other people's couches. And the way they grew is they bought other such websites. So they made a couple of acquisitions, and that got them more travelers and more hosts, and they became pretty big. And as they became big, of course, the marketplace that they engaged in changed. And so today, their competition isn't other websites, although there are some other websites. Their competition is Marriott and Hilton Hotels and other places where you can stay. And of course, one of the things they had to do to get that thickness is they had to enable hosts to work in a way that didn't need the economies of scale. I just stayed at the La Jolla Beach and Tennis Club, and on days when they have water, they have a cleaning staff, they have all sorts of stuff that allows them to work. But if you're running Airbnb, you need to hire cleaners on your own, and of course, there are now all these interacting markets. You can, if your regular cleaners don't come, you can hire them on TaskRabbit. But as Airbnb got big, they needed to deal with congestion. And to think about the congestion problem that Airbnb has to solve, imagine if Hilton Hotels could only answer your queries one room at a time. So you'd call Hilton Hotels in San Francisco and you'd say, next Friday, how about room 1228? And they'd say, I'm sorry, room 1228 is booked. And they'd hang up. And now you had to call again and say, well, how about room 1230? So that would make it a lot harder to book a hotel room. Now, of course, Airbnb is a little like that. Each room is different. So when you think about how the web and lately mobile communications and apps have facilitated Airbnb's market, you realize they had this enormous congestion problem to deal with that they're solving through these ways that we now deal with it. And of course, they have, congestion has to do with speed of response too. In the early days of Airbnb, when people weren't using mobile communication so much, you might have to wait a day to find out whether you got the room that you tried to reserve. Now they can do that quicker. So these are these critical problems that marketplaces have to solve in order to make the market work, and we see it working for Airbnb. And of course, there's lots of issues of trust and safety with travelers and hosts meeting each other, when they don't know each other, having someone come into your home and all those kinds of things. So let me take you back now to tell you about some similar issues in the market for doctors in the United States. So this is a market that I've worked in a lot. It's one that most people here won't participate in, but I want to tell you about it so you can see the parallels to something like Airbnb, how they dealt with the problems of making the market thick, how they dealt with the problems of dealing with congestion, and what were the issues of safety that came up. And of course, these are problems that you don't solve once and for all. You have to keep resolving them as your market changes. And that's a little bit what I'm going to tell you about. I'm starting with some quite old work, and I'll end with some very new work, my discussion of this market. So when doctors graduate from medical school, their first job is called an internship or a residency, and they need that job to be licensed to practice medicine in any of the 50 states. It wasn't always like that, but this kind of job started around 1900. It started to be the standard post-graduation job for doctors. And in 1900, what happened, there were 4 years of medical school, and around the time people graduated from medical school, they started to look for their next job. These jobs typically start around July. And there was some competition among hospitals for the new interns and residents. And one form that competition took was it started to make hiring dates, the dates at which you'd sign contract, move earlier and earlier. So it used to be that around graduation time, around June, people would be getting their jobs. By around 1930, they were getting jobs in December of their senior year. And there was some discussion in the medical literature about how this was a little early because you didn't find out how people had done their senior year. But by around, and maybe we shouldn't do it anymore, but discussion about how you shouldn't do it anymore doesn't have a lot of traction if you don't change the underlying economics. And so by 1940, the standard time at which American doctors got their first jobs was 2 years before graduation. They'd get it in the summer after their second year of medical school, and they still had 4 years of medical school that had to be completed. So they were getting it 2 years in advance. And a lot of the important information about match quality is lost when you have to hire people 2 years in advance. You don't know who the good doctors are if you're a hospital. And the medical students don't know what kind of jobs they want because they haven't yet experienced a lot of medicine. So you could be a medical student who got A's in anatomy and thinks you want to be a surgeon. You get a great surgical job 2 years ahead after your second year of medical school. And in your third year of medical school, you get to attend some surgeries and you discover that you faint at the sight of blood. And it's going to be a terrible match, but it's too late. The market has already cleared. So there were a lot of inefficiencies of that sort. In the 1940s, the medical schools intervened and controlled the information. They said, you guys, the medical schools are a third party. They're not the hospitals and they're not the doctors. The medical school said, you guys are out of control. You're getting earlier and earlier. We're going to restrict the flow of information. We're not going to release transcripts. We're not going to release letters of recommendation. We're not going to confirm that students are enrolled in our medical school before a certain date. And that controlled the date of employment. It's risky to hire someone 2 years before he graduates. It's even riskier to hire him when he only claims to be in medical school. So they controlled the date of appointment, but they ran into another set of problems that had to do with exploding offers. People discovered that if they made an offer and left it open for a while, there was a good chance when you said no that the people who they were planning to make offers to next would already have said yes to someone else. So the allowable time for offers to remain over shrank over the next 5 years until people were getting phone calls in 1950 that said, here's an offer, you have to say yes or no over the telephone because if you don't say yes, I'm going to make an immediate offer to the next person on my list. So that also lost a lot of information about the market. That is, why is that an unpleasant phone call to get? You say you have to decide on the phone. The reason is you don't know whether the phone would ring again as soon as you put it down. There might be other offers coming to you. You'd like to compare them, but having to accept an exploding offer deprives you of that information. So once again, the market wasn't working well. It wasn't producing good allocations, in part because information was missing. And they did a radical thing in the 1950s. The various medical organizations ganged together, and they created, with a little bit of trial and error, a kind of clearinghouse which in its rough form survives till today. The way medical students get their jobs, starting in about 1952 and going through till today, is they go on lots of interviews, and then after they've done their interviews, they submit rank order lists. The students say, here's my first choice job, my second choice, my third choice. They've already learned the salaries, which are part of the job description. The hospitals, the residency programs say, my first choice student, my second choice, my third choice, and then something happens. There's a day called match day. Matches are suggested, and it's been very successful at, when you go in July and you look at which doctors are in which hospitals, very high percentages of the ones are where they're supposed to be. So starting in the 1950s, they didn't have any compulsory process. This was all voluntary, but it very quickly started to be successful. I got involved first studying it, but then later helping to redesign it, because it started to be less successful when couples entered the market. So if you think about the 1900s, the percentage of women in American medical schools was roughly 0%. And by the 1970s, it was about 10%, and today it's 50%. And medical students are very busy, they work very hard, so they marry each other. So there are a lot of couples on the labor market. We have about 16,000 graduates of American medical schools each year. Last year, we had about 1,800 of them entering the market as couples, so 900 couples. So a pretty big number, and of course, couples are complex in ways I'll tell you about. Only some of the ways. So let's just think about what happened here, because it's happened in lots of markets. But from 1900 to the 1940s, the market was unraveling. It was getting less and less, it was getting earlier and earlier and less thick as the offers came to you, sometime in the summer after your second year of medical school, when a lot of information was missing, both information about match quality, but also market information, because you didn't know what other offers might come later. And they then went to this 5-year period of uniform dates were enforced. They got the dates down right, but they still didn't get the market information there, because people had to make lots of offers really quickly so that the people they wanted to make offers to wouldn't have already accepted them. So they lost market information. And then they went to these centralized market clearing procedures. Now, let me mention that all these arrows I've shown, the story I just told you is the doctors are still here. But all these arrows are transitions I've observed in some market or another. So lots of markets, the centralized market clearing procedures don't work, and they end up unraveling again. So one question that I want to talk about is, what is it that makes a clearinghouse work, a centralized marketplace work? And one of the things that I'll talk about today is that it has to make it safe for participants to reveal their information about preferences. So think about being a graduating medical student or a residency program that wants to hire them. There comes a critical time, it's around this time of year, in early February, where they're going to say to you, submit a rank order list. Well, as an experienced or a very interested person in this market, if you're participating in it, you've got to ask yourself, is it safe for me to submit a preference list that looks like my actual preferences? Or to get something I want, should I be cleverer? Should I think about what to say in order to get what I really want, rather than saying what I really want, which they might not give me what I really want? So that turns out to be critical, keeping things here and not making them go up to the top, and we're going to talk about that. So let's have a hypothesis about what makes clearinghouses successful, what keeps us down here rather than shooting back to the top. And remember, this is a voluntary procedure by and large, not everywhere, but in this market it was. So the centralized clearinghouse is going to suggest a match. There's going to be match day, and if you're a student, they're going to suggest a firm, an employer, and vice versa, and they're going to say, you guys should exchange contracts now. You expect a contract in the mail and sign it and send it back. So what's likely to make this work, as opposed to make people not sign those contracts and end up working somewhere else? So let's have a simple theory which says a matching is stable if there isn't a doctor and an employer, a residency program, who are not matched to each other, who would both prefer to be matched to each other. And the hypothesis I'm going to offer you is that successful clearinghouses are the ones that produce stable matchings. So this is a very simple theory. You can easily see why I might think that a matching that produced an unstable outcome would not get a lot of voluntary compliance. The reason is, supposing the outcome is unstable. That means there's some doctor, say me, and some hospital, say you, who would prefer to be matched to each other than who the match recommends that they be matched to. So supposing I'm the doctor involved, and the clearinghouse says to me, sign a contract with your third choice hospital. But I would actually prefer one of my first or second choice hospitals, obviously, and one of them is you, and you would prefer to hire me. I only have to make 2 phone calls to find you. Right? I call up the 2 hospitals I'd prefer to go to, and I say, I did well in the match. I'm about to sign the contract they recommended, but before I do, I was wondering whether you had any extra spots. And because the matching is unstable, you look at the people you're supposed to match to, and you notice that you like me better than at least one of them, and you say to me, you know, by a stroke of good luck, we have an extra position this year. Why don't you come to us? And then you call up some other unfortunate guy, and you say to him, bad news. You know how deans are. We lost a position. We're not going to be able to sign the contract. So if the match were unstable, you would expect some non-compliance. And of course, that would ripple out. Now there'd be other people not going where they were supposed to be matched. So it's a good theory. How do you test it? Well, you can look at clearinghouses and see whether the ones that produce stable matchings are still in use or not. There isn't that much evidence. It's a small data set, but you start to look at this and you see that a lot of yeses in the first column are associated with yeses in the second column. Not 100%. A lot of no's in the first column are associated with no's in the second column. And one of the things it leads you to do, because there are differences between different regions of the British National Health Service and these other things, you can bring this into the laboratory and do experiments as well, where you can turn on and off whether the match is stable and whether the algorithm produces a stable match and get the outcome. So over time, with these kinds of evidence, there's a lot more evidence today, we start to think that stability is an important feature of a successful clearinghouse. Now, I should say that the yeses in the stable column, that answers the question, does the algorithm involved produce a stable matching with respect to the preferences that have been submitted to it? So I haven't yet addressed the question of, when we ask you your preferences, should you tell us or should you tell us something else? Okay, which is clearly going to be important, because remember, markets like this one are tools for aggregating information. The idea is to find a good allocation, a good matching of students and jobs. To find that, we need to know what the students want and what the jobs want. To know that, we have to ask them, and they have to want to tell us. So that's the problem I'm getting ready to address. So let me tell you how we produce stable matchings. This is this particular statement of the algorithm is from a 1962 paper that for which Lloyd Shapley won the Nobel Prize. David Gale was deceased. And I'm going to tell it to you as if people are doing things, but for the moment, think about it now as a computer algorithm. So what we've done is we've elicited preferences from people. Now I'm going to tell you the steps that we're going to go through in the algorithm. But for reasons that'll be clear, in a moment, I'm going to tell you in this active voice as if people are doing things inside the algorithm. So here's the program, the employer offering algorithm. Each program with 5 positions makes offers to its top 5 candidates, if it's got that many. And each applicant looks at all the offers he's gotten, if any, and gets rid of the unacceptable ones, the ones that he wouldn't go to if he didn't even have another job, and looks at them in order of his preference, rejects all but the best of those, and doesn't accept the best one, but doesn't reject it either. Okay? And at the next step of the algorithm, at every step of the algorithm, any firm whose offer has just been rejected makes an offer to its next choice applicant. Each applicant looks at all the offers that have come in so far, the new ones plus the one held from the last period, if any, keeps the one it likes best and rejects the rest. And the algorithm stops in finite time, as it must, because no firm makes an offer twice to the same worker. The algorithm stops when no one wants to make any offers. And only at that point are the acceptances made. At that point, each worker accepts the offer from the firm whose offer he's holding, if any. And that's the matching. That's why it's called a deferred acceptance algorithm. The acceptances are deferred until the end. There's another version of this algorithm which has the applicants applying. The applicants apply to their first choice jobs. The firms look at how many applications they've gotten and how many positions they have, hold all the ones they can of the best ones they've gotten, reject the rest. The rejected applicants propose to their next choice firm. The firms look at the applicants, not caring at what stage of the algorithm they applied, just how much they like them. They keep the ones they like the best, reject the rest. When the proposals stop, everyone is matched to the offer that they're holding. Okay? These produce a stable matching, these two algorithms. They produce sometimes different stable matchings, but they produce a stable matching. Let me prove that for you. Okay, this is one of the things that Gale and Shapley proved in their 1962 paper. What does it mean, stable matching? Well, supposing I'm one of the applicants, and supposing I match to my third choice firm, say in the applicant proposing algorithm. How do I know that the matching is stable? It means that neither my first nor second choice prefers me. I prefer them. I wish I were matched to my first or second choice, but I'm matched to my third choice. What happens if I call you up and say, how about me? Well, how is it that I'm matched to my third choice? I applied to my first choice, was rejected. I applied to my second choice, was rejected when they got someone better. Applied to my third choice, was never rejected, so I was accepted at the end. So if I call you up, you don't prefer me. You already rejected me in favor of some application you got that you liked better. So although I may not be happy with the job I got, it's not the best job I could have gotten, there isn't any firm doctor pair that both prefer each other. If I prefer you, you don't prefer me, and the outcome is stable, so I should go ahead and sign the contract that I got, which is the best offer I'm going to get. Okay, so that's a stable matching. So Gale and Shapley proved that in 1962. The algorithm has the additional property that, as an applicant, I can't do any better than to state my true preferences. Okay, so this is the part about the safety of revealing my information. And the reason I can't do any better than to state my true preferences is because think of the applicant proposing algorithm where I'm applying to firms and you firms are getting applications and then rejecting the ones who you don't want to employ and holding on to the others. If I get rejected by my first choice and now I apply to my second choice, as my second choice firm, you don't care that I applied late in the game. You just look at how much you like me. So my chance of getting my second choice firm, once I've been rejected my first choice, is the same as if I had listed it as my first choice. And that's actually a critical element in showing that I don't lose anything by revealing my true preferences, because if I don't get the firms I like better than you, my chance of getting you hasn't been harmed by the fact that I tried to do better. Okay, so that's a critical fact, and the formal statement is that it's a dominant strategy for students to state their true preferences. And in large markets, it's virtually a dominant strategy for all participants to state their true preferences. This is an area, incidentally, where computer scientists and economists have come pretty closely together. So what that means is when we look back at a graph like this and we say, I have a yes in the stable column if the algorithm that's being used produces a stable match with respect to the stated preferences. What these theorems say is, the stated preferences have a very good reason to be the true preferences. No one can profitably deviate. Right? The good advice in this market is to write down your true preferences. Okay, so maybe that's why markets that look like they're producing stable matchings actually produce stable matchings, and that's why they're widely successful when used. So, as Atila mentioned, the way I got into this in a 1984 paper was I observed that the medical match that they'd adopted, in the 1950s, was equivalent to the kind of algorithm I just showed you that Gale and Shapley wrote about in the 1960s. So by a process of trial and error, they had, and they'd had some dramatic errors, they had reached a clearinghouse that produced stable matchings. But when couples started to be a noticeable part of the market, it stopped working so well. So the algorithm worked very well in the sense that if you looked on July 1st at which new doctors were employed at which hospitals, it corresponded very closely to the ones where they'd been assigned. But when couples started to enter the market, that correspondence stopped being so close. So they noticed this. So in the 1970s, about 10% of the graduating class in American medical schools were women. And they decided to try to accommodate the couples because the couples weren't showing up where they were supposed to. They were getting on the phone and finding jobs they liked better and getting hired by hospitals that hadn't been matched to them, who were then not hiring the people they were supposed to hire, and there was this ripple effect. So the 1970s was really a long time ago, it turns out. So the way the initial couples algorithm worked is first you had to be, if you wanted to enter the couples algorithm, you and your spouse, first, your medical students, first you had to be certified by your dean as a legitimate couple, okay? And then you had to specify one of the members of the couple as the leading member. And the way they ran the algorithm is the leading member and the other member of the couple were invited to submit preference information as if they were single. That is, the information I would be invited is, what is my first choice, what is my second choice, what is my third choice. And similarly, my wife would be invited to submit a list like that. Then, whichever one of us we'd specified as the leading member would go through the match and get a job in some city, hopefully. And then they'd go through the list of the other member, crossing out places that weren't in the same city, so that in that way they'd hope to get us 2 jobs in the same city. But this didn't work very well in the sense that the couples weren't showing up where they were assigned. And later they just stopped entering the algorithm. So why didn't this work well? Well, there's the iron law of marriage, which says you can't be happier than your spouse. So think about me and my wife. We want 2 good jobs somewhere. So our first choice is 2 good jobs in San Francisco. Our second choice is 2 good jobs in San Diego. Our third choice is 2 good jobs in Boston. But because of the way they were working the algorithm, we get 1 good job in Boston and 1 not so good job in Boston. And that's where the iron law kicks in. So we can tell we're not going to be happy with 1 good job and 1 crummy job. So we get on the phone and we find 2 hospitals in New York that we'd be pretty happy at, and they're happy to get us. They didn't know we were still available, and so we don't go where we were matched. So the problem is that this couples algorithm wasn't asking for the right information. The couples consume pairs of jobs. If you want to know what couples want, you have to ask them, what pairs of jobs do you want? Because you're both going to be employed. And so there was no chance of getting to a stable matching that involved couples if you didn't ask the right question. Turns out there's problems getting to a stable matching even when you ask the right question, because that nice theorem I showed you with the deferred acceptance algorithm that says you can always find a stable match isn't true anymore when there are couples in the market consuming pairs of decisions. I'm not going to show you that. We started late, but you can show it with a very small example. So here's an example with 1 couple and 1 single person and 2 hospitals, and you can easily convince yourself these are the preferences. The couple will only take the job H1, H2. He in hospital 1, she in hospital 2. Otherwise, they'll stay where they are. You can easily convince yourself in this tiny example that there are no stable matchings. Every matching you can propose has blocking pairs. So it's not hard to find couple examples with couples in which stable matchings no longer exist. And let's think about why it's hard. Why doesn't the deferred acceptance algorithm work? Well, think about the applicant proposing algorithm, right? When there are just single people, what the proof that it produces a stable matching has to do with the fact that if I'm not matched to you, it means you already rejected me, and that means you don't want me. But that's not true with couples anymore. Supposing my wife and I are a couple and we first apply to 2 jobs in Boston, and our applications are held, and so you, the firms that are holding my application and my wife's application, you have to reject some people in order to hold our applications. Later, someone else applies to the firm that's holding my application, and they like that person better than they like me, so they hold his application and they reject mine. Well, but my wife and I have preference over pairs of positions, and our next choice isn't 2 jobs in Boston, it's 2 jobs in New York. So the algorithm now has to withdraw her application from the job that was holding it. a job that had to reject some other people in the anticipation of hiring my wife, but isn't going to hire my wife. So there are now some blocking pairs that could exist, right? You rejected people in order to hold my wife's application, but my wife is in New York. She's gone. So there's no longer going to be a one-pass algorithm that does this. And the firm proposing algorithm runs into similar troubles that we actually see. You know, a lot of markets aren't centralized in a clearinghouse. One of the markets I studied was a market for clinical psychologists. So they're healthcare workers, but not MDs. And they had a telephone market. They had a market that on the second Monday in February, everyone would sit by their phone and make offers to each other. And the rules were deferred acceptance by telephone. Well, it turns out that if you're a couple, you can't do what you're supposed to do in the deferred acceptance algorithm. And the reason is, you know, supposing my wife and I, you know, our first choice is 2 jobs in San Diego, and our second choice, 2 jobs in San Francisco, then Pittsburgh, then Boston. And suppose right at the beginning I get an offer from San Francisco, and then I get an offer from Boston. What I'm supposed to do is reject one of them and hold on to the other one. But if my wife, meantime, hasn't gotten a matching offer, if she gets an offer from San Diego and Pittsburgh, we don't know which one to reject. If I reject the Boston offer, she might get a Boston offer pretty soon, and then I'll be sorry to have rejected the Boston offer. And similarly, if I reject the San Diego offer. So even a small number of couples quickly causes that process to grind to a halt. The couples are holding all the offers, or they're holding too many of the offers, and the market can't go. So this is a market that subsequently went to a computerized algorithm, and the kind of algorithm that it uses is the one that doctors now use, which is single students fill out rank order lists, as I described to you, of, you know, my first choice, my second choice, my third choice. Couples fill out rank order lists of pairs of positions. Here's our first choice pair of jobs, our second choice pair of jobs, our third choice. And at the end of the market, there's a scramble. There are always some jobs and people unmatched, and there's a secondary market. Part of the argument I'm going to make to you is that a scramble is an unavoidable part of a market like this. So the current match algorithm is a complicated one. I'm not going to go over it. Let me show you a flowchart and just say that the left side is the deferred acceptance algorithm. Okay, it's the algorithm I've already told you about. The right side is every time we have to pull a spouse out of a position, right? Instead of having someone better come along and be rejected, we have to pull them out when the couple has to go somewhere else. We create a stack of potential blocking pairs that'll have to be resolved. And it turns out to be possible to resolve those. Of course, it wouldn't be possible if no stable matching existed. So we know it's easy to find examples where no stable matching exists, but as a matter of practice, there are lots of clearinghouses using the Roth-Perenson algorithm now, including the psychology internships that the year after I studied them decided to go to a centralized match. These are annual markets. Many of them have been used for years. They always find stable matches, even though there are couples. So there's an empirical puzzle here, which says, how come these markets are working well? That is, we're luckier than we know we're entitled to be here. We have couples. The markets are working well. This is sort of an engineering observation. You know, you build the thing, it works well, and then you have to figure out how come it's working so well. So some clues are that when the market gets big, the set of stable matchings gets small, but it turns out not empty. And this has to do, I think this has to do, I mean, we have some theory now that suggests this has to do with the fact that even though the market's big, very few people can apply to many jobs. It's costly to interview. It's, you know, the market can get bigger and bigger. We use limit theorems to study it, but the number of days between November and February doesn't get large as the market gets large. So the number of interviews you can go on stays pretty finite. And it turns out when that happens, it becomes safe for people to state their true preferences. And to talk about this, I'm going to make a probabilistic statement, so you have to start talking about random markets. But as the market gets large, the probability that a stable matching will exist gets large also. So it has to do with the way the market gets large. The market gets large, but no one can apply to a very high percentage of the positions. And that turns out to mean that couples rarely interfere with each other. It also has to do with why it's safe to state your true preferences. The way you might profit by not stating your true preferences is you get some offer, you get multiple offers, and instead of keeping the one you like best, you keep a different one and reject the rest. Why might you do that? Well, by rejecting someone, by rejecting anyone, you set in motion a rejection chain. They apply somewhere else that might reject someone else that might eventually apply to some, if you're a firm and the applicants are applying, it might eventually cause someone to apply to you who wouldn't otherwise have applied to you, but who you prefer. But it turns out when the preference lists are short, one of the properties of the market is that there's going to be a relatively large number of firms that don't fill their positions in the main match. And that means if you set in motion a rejection chain, it's more likely to end when someone applies to a firm that hasn't yet filled itself up than it is to come back to you with someone you prefer. Okay, so that both explains why it's safe to state your true preferences. You don't profit from rejection chains, but it also explains why we need a scramble. That is, if there are always going to be coordination failures when firms have to decide who to interview and applicants have to decide what interviews to go on. So this is an area of continuing work. There are better results than the one I showed you, than the one that my colleagues and I produced. So Itay and his colleagues as a computer scientist have some better results. Right now, those results depend on the number of couples growing sublinearly in the number of jobs. But of course, if the number of couples really grew sublinearly in the number of jobs, then when you took the limit, they wouldn't be couples worth bothering about. So one of the problems about looking at limit markets is the limit market sometimes has properties that the finite markets that you're interested in don't have. So among the open questions is what can we say about markets with positive proportions of couples, which is the kinds that we're seeing. Let me very, very briefly tell you something about school choice before I end, because I know we started a little late. And let me tell you the punchline before I tell you the problem. In these, unlike the organ markets that I'll talk about in the next session, here the solution is going to be very, very close to what I just showed you. It's going to be a deferred acceptance algorithm for matching children to schools. But let me tell you about this, because this is work I've done with Atila and others starting in 2004 when we redesigned the system by which New York City assigns children to high schools, and shortly after when we worked in Boston. And remember, it's a problem about aggregating information. But sometimes you're aggregating information from very different kinds of players. So here's a market where we're trying to figure out where parents would like their kids to go to school. And the parents are not experienced participants in this market. The participants in this market are people whose child just became kindergarten age. And now they have to do something with the school system. They have to interact with Boston Public Schools or New York City Department of Education. So these are people for whom the problem of eliciting information is not only do we have to make it safe, we have to make it simple. Right? So one of the benefits of being able to say you can't do better than to state your true preferences is you can give them advice on a simple way to interact with the system. Okay? So as I said, we've been working in a bunch of different schools now with our various colleagues, and we formed an organization, a nonprofit organization called the Institute for Innovation in Public School Choice. Let me summarize some of the problems by telling you how Boston, the city of Boston, used to assign children to schools. By the time we knew about them, Typhoon Sonmez and Atila studied this problem some years ago. By the time we knew about them, they already had a centralized system. And the way it worked was the following. Students were assigned priorities at schools. You'd have a high priority for the school near your house or a school where your sibling went. And families submitted strict preferences, and what the school did, what the algorithm did, was it tried to give as many people as possible their first choice. So, what a simple, benign algorithm. We're just going to give as many people as possible their first choice. When we've done that, of those remaining, we'll give as many people as possible their second choice. When we've done that, right? Clearly, an algorithm designed to be nice to families. What could be wrong with that? Well, what could be wrong with that is it doesn't make it safe to tell the school system your true preferences, because you've got priorities, say, at the school across the street from your house, but it's not your first choice. But if you don't list it as your first choice, and then you don't get your real first choice, which is somewhere far away where you don't have a lot of priority, then it's going to fill all its places with people who did list it as its first choice. Right? Because they're going to give as many people their first choice as possible. And although you live across the street from the school, by not listing it as your first choice, you lose all your priority. So it's not safe to take a chance on the school where you'd really like your kid to go to. You have to list this school as your first choice. Okay? And that was a problem that everyone had come to recognize over the years. So the Boston Public Schools brochure would say things like, for a better chance of your first choice, that's their quotes in there, consider choosing less popular schools. Right? It was just too dangerous to state your first choice. And when you looked in the newspaper and when you looked at parent groups, they understood this. Not everyone understood it, though. So the West Zone Parents Group understood it. They're an affluent neighborhood of the city. But when we looked at the data, we found that a lot of families didn't understand it and would list, for instance, as their second choice, a school that no one ever got into except as their first choice. And what that means is you didn't get into your first choice, you've wasted your second choice. You're going to end up in a school that still has places available after everyone has gotten all their choices, which means you're going to end up in a school that isn't a very good school. So lots of bad things were happening. And preferences were gamed, and it was hard to do effective planning because the preferences were so gamed, the school board, the Boston Public Schools, wasn't getting the information it needed to evaluate schools. They couldn't tell which schools people liked and really wanted to go to, and which were schools that people merely thought were the school they had better list as their first choice. Okay, so today we fixed that. Today there's a student proposing deferred acceptance algorithm going on there. The problem in New York City was different. They had a congestion problem, right? So Boston had a safety problem, safe to reveal your information. New York City had a congestion problem. New York is big, 90,000 ninth graders each year. So what they did is they had a decentralized process, semi-centralized. If you were an eighth grader, you'd fill out a rank order list. It would be Xeroxed and sent to the schools that you had listed. That was your application. And then they would do the process through the mails. And 17,000 students got multiple offers, desirable kids. And 30,000 didn't get any offer at all and were slammed into schools in late August that they hadn't expressed any preference for. So there was a real congestion problem. The fact that the schools saw the rank order list also meant that, like Boston, a lot of schools wouldn't admit you if you hadn't applied to them as your first choice. Right? So it wasn't safe to put down your true preferences, and they couldn't process all the applications. Principals concealed capacity. The system worked so badly that principals knew that they were going to be blocking pairs. They knew it wasn't going to be stable. They'd better hold some positions in reserve for students they wanted, who they would like better than the ones that they would get through the centralized assignment process. So both in New York and Boston, we wanted to deal with congestion and make it safe for families to reveal their true preferences. And we do it with a deferred acceptance algorithm. I'm not going to go over it again, except to notice that when I say the students and the schools submit their preferences, here now they do them privately. The schools can no longer see the preferences of the students, so they can't make their admissions decisions contingent on where you rank them. They don't know where you rank them. That part is private. All the theorems I showed you interpreted for schools means that principals no longer want to withhold places because there are no blocking pairs, and it's safe for students to state their true preferences. And in New York's first year of operation, instead of having 30,000 students left over, we only had 3,000 left over. And then a remarkable thing happened. In the first 4 years of operation, no further changes were made. But when you look at the number of people getting their first and second, or first, second, and third choice, what you see is the distribution moving forward towards 2007, the later distributions stochastically dominate the earlier distributions with no change in algorithm. What's happening is all those withheld places are coming back in. As the principals gain confidence that the best way to get good students is to go through the centralized clearinghouse, they're enrolling their places in the system. And so more good places are being made. let me wrap up now. I've told you about two unusual markets that you might not normally think of as markets, right? Because price doesn't do all the work. In public schools, we don't let price do any of the work. But they still have the same kind of problem that Airbnb had of making a thick market and dealing with the congestion and making it safe to participate in. You can take a market design angle to ask lots of questions about contemporary markets. Think about Uber, which has now made a reasonably thick market. But can they hold on to it? Can Google encroach on Uber? Maybe they can. Would it be hard for Google to take away that thick market and have a thick market of its own? How about having a lot of information that used to go over the internet going through apps? What will that do to the thickness of Google's market? So these are general marketplace questions. And in the next session, we're going to have, in this room, I think, we're going to have a session where we talk more about these things. And what I will talk about is kidney exchange, a really unusual market which has now become a standard part of American transplantation, and in which, the mathematics are very different, but like schools, no money changes hands. It's a felony in the United States and just about everywhere in the world except the Islamic Republic of Iran to buy or sell organs for transplantation. Thank you. Okay, the question is, the academic job market seems to Vijay to be inefficient and archaic. Can something be done about it? Well, academic job markets are very different from each other. In economics, we have a more centralized market than you do in computer science or electrical engineering. We have an annual meeting, takes place in the first week in January, where we do a lot of interviewing, and then we invite students for flyouts. But everyone, 15,000 economists are at the meetings this year. It was in Boston, and a lot of interviewing gets done then. Now, as a result, we have something of a congestion problem. We get hundreds of applications. We can do maybe 20 interviews at the meetings, and we can invite maybe 8 people for flyouts. So one of the things my colleagues and I did, I was chair for some years of a committee for suggesting design changes in the economics job market. We instituted a signaling mechanism. One of the things that causes congestion is it's cheap and easy to apply for jobs nowadays. It's not costly. You can easily apply for another job once you've got your packet together, especially now that you're uploading things. It's really easy. But the American Economic Association now runs a website in which you can send a signal to up to 2 places, no more than 2. They enforce that. And what that means is if there are some places that you think might not look at you but should, you can send them a signal. And the value in the signal comes from the fact that you can send out 100 applications, but you can only send 2 signals. So it's a little bit of a complicated decision where you should send your signals, but those have helped relieve some of the congestion. In order to get big changes in a market, in my limited experience, the market has to be working so badly that there's blood on the floor. As long as the inefficiency in the job market is primarily borne by newly graduating PhDs and not by departments, it's hard to get the organization of various academic markets to change. Thank you.